The first part of the abdominal assessment that we're going to do for this patient, we're going to have him in supine position with a pillow under his knees and one under his head so he's comfortable. And I'm just going to come in and introduce myself and perform hand hygiene and explain to him that the first part is just inspection. We're just going to look at the abdomen. We're going to inspect it and make sure everything looks fine. We're going to map out the abdomen. You're going to make sure you can distinguish your 4 quadrants. You want to note that this client has a flat contour and the position of the umbilicus. It's not protruding, it's not bulging, there's no drainage. He doesn't have any lesions or scars that you can note. The next part of this assessment, we're going to do auscultation. And this is where I'm going to instruct the client that we're just going to be listening to the sounds in his abdomen. The first thing that we're going to assess is vowel sounds. And this is where you're going to want to go through your 4 quadrants. And you're going to listen in each quadrant for 60 seconds. And you want to go in a circle from where you start. So I'm going to start in the right lower quadrant and work my way around to the others. And that was obviously not 60 seconds for demonstration purposes. Normal bowel sounds you're going to hear 5 to 30 times per minute. Then the next part we're going to assess for vascular sounds. The first area I'm going to listen to is in my aortic, which is below your xiphoid process in the midline. And then your renal will be on your right side. I'm going to listen, and then iliac, I'm going to go to the left below your belly button, and then femoral will be by your femoral artery. The next thing you want to listen for is friction rubs. Friction rubs are coarse, grating sounds that you hear normally over the spleen or the liver, and these are not normal, so those are something that you really want to be listening for. First, I'm going to listen over the patient's right side over his liver. And then on the left side for the spleen. The next part of the assessment is going to be percussion. The first thing you're going to do is visualize the abdomen and think about where your structures are under your abdomen. Think about where your liver lies and your spleen. You want to think about your normal bowel sound, or your normal sounds that you're going to hear whenever you're percussing. You're going to note that tympany is usually heard over your abdomen, and it's a louder, hollow sound, and dullness is normally heard over your solid organs such as your liver, your spleen, and it's more of a short, high-pitched sound. You're going to instruct your client that you're going to be tapping on their abdomen, and they just need to be breathing normally, and if they have any discomfort, just to relax and take some deep breaths. The first area that you want to start in is your right lower quadrant, and you want to tap and see if you can hear. And as you move along, you want to follow your path. You want to go from your right lower to your right upper, and you want to come up around by the liver, over to your spleen, to your left upper quadrant, and to your left lower quadrant. Next, you want to percuss around the liver, and this is going to be where you find your upper and your lower borders for your liver. and you're going to instruct your client that you're just going to make a mark on their skin where you can measure how wide or the span of their liver is going to be, and normal is 5 to 10 centimeters. For this, you want to start in your right lower quadrant, and you're going to hear tympani to start with. And when you get to your area where you hear dullness first, that's going to be your first mark for your lower border of your liver. And then you want to start at your fourth intercostal space down, and you can start. You're going to hear renaissance at first because you're in your lungs, and whenever you hear dullness again, you're going to mark that that's your liver span. Next, you want to go to your spleen, and this is going to be on your left midline. And same goes for it. You want to tap until you hear your dullness, and that's going to be where you can assess where your spleen lies. You're also going to want to look for your gastric bubble, which would be where your stomach is. Depending if your client has just ate a meal or not, this could sound dull as well, and you're just going to want to percuss over where your stomach would lie. The next step in this abdominal assessment, I am going to palpate the abdomen. Whenever you're palpating an abdomen, you're looking for organ size and placement, muscle tightness, guarding any masses or tenderness, or presence of fluid. After you do this after auscultation because you want to avoid changes in any of the natural patterns of the noises in the abdomen. You want to assess your painful areas last. So in this client, his pain is in the right lower quadrant, so we're going to assess that area last. You want to use light palpation under all 4 quadrants, but like I said, with his being in the right quadrant, we're going to assess that last. You want your client to take several deep breaths so they can relax their abdomen, and so I'm going to lightly palpate this client's abdomen. And I'm going to note for any tightness or tenderness, and I'm going to ask the client if he feels any tenderness whenever that's being done. Next, I'm going to palpate the liver. I'm going to take my left hand and place it under the client's back, and I'm going to take my right hand and place it kind of up under the client's rib cage. I'm going to ask him to take a deep breath and exhale. And as the client exhales, you shouldn't be able to feel the liver in a normal patient that doesn't have any hepatomegaly. But as they exhale and the diaphragm releases, that would be the time where you might be able to feel the end of the liver in the corner of it. It should be smooth and round. Then next I'm going to palpate for the spleen. I'm going to take my left hand again and place under the client's back. You want to tell your patient that you're going to lift up on their side a little bit. You want to be careful when palpating for the spleen because it's a fragile and tender organ. For this, you want to use the same technique, and you're going to ask the patient again to take a slow deep breath in this time. And then as they exhale, you shouldn't, in somebody that has a normal size spleen, you shouldn't be able to palpate it either. You can also assess for aortic pulsations. You're going to go on the left side of your midline under your xiphoid process, and you want to check it. Then you can also assess for somebody, in this case, that you might be thinking could be having problems with appendicitis. You want to check for rebound tenderness, and for this you want to take your hand at a 90-degree angle and push firmly down on the client's abdomen, and then release fast, and if they complain of tenderness once you release, that's a sign of rebound tenderness. Another assessment, you can take your left hand above the client's right knee and ask them to raise their leg up to meet your knee, or raise their knee up to meet your hand. And if pain is noted with this, then that can be another sign of appendicitis.